Hello and welcome to our Gold Learning viewers. I'm Fiona Lang-Sharp, IBCLC and Director of Communications here at Gold Learning. Well, I have the pleasure in introducing a very special guest today, Professor Jayashri Kulkarni. Welcome to our interview today and a very special presentation that you're going to be giving as part of the add-on package here at Gold Perinatal 2018. We have a special add-on package called mental health in the perinatal period, and I'm so grateful that you're here and going to be talking about this. Welcome to Gold Learning here.
Thank you very much, Fiona. It's my great pleasure and privilege to be part of your Gold package.
That's wonderful. Well, first of all, I would love it if you could introduce yourself to our listening audience today and perhaps tell them a little bit about yourself, what you do, and of course where you are in the world as well.
Love to. So my name is Jayashri Kulkarni and I am an Australian psychiatrist. I'm based in Melbourne, so please come and visit us in beautiful sunny Melbourne. We have a large research centre here that I founded and direct since 2002. My passion, my absolute passion, is for women's mental health. And I'm really sad to say that unfortunately women's mental health is not really a priority in Australia or in many countries around the world. And working with my colleagues in the International Association of Women's Mental Health, we are fighting very hard to make the needs of women who have mental ill health uppermost in the minds of politicians, bureaucrats and other policymakers around the world, because really it's more than half the population and there are special needs that women have. Pregnancy is clearly one that is a clear area that has not had as much attention as it should, but there are many, many other areas in women's mental health that really need more attention. So I'd be glad for all of you to join us in trying to make women's mental health everyone's business.
Well, I certainly feel like it's getting highlighted more, Jayashri, but just not enough yet. It feels like we're turning the corner, and reading your bio, I know that you've been involved in this field for a long time, and so have you seen some changes recently where it's alluding to more care, more recognition, and those types of things?
I think we have seen some great advances in some parts of the world. In particular, I'm very pleased with what's happened here in Australia and other Western nations regarding the domestic violence or interpersonal violence issue, which of course affects women much more than men, although, you know, there is interpersonal violence against men as well. But nonetheless, that is an issue that has reached national significance with a number of initiatives undertaken. I was also quite heartened to see some of the other initiatives that have hit the presses, the #MeToo, consideration of the role that women have in our psychosocial world, in economic disparity between male and female salaries, all sorts of activities.
Oh, yeah.
But it's all good work, but what we need to do is ensure that this continues on in a cohesive and very impactful manner, rather than just individuals perhaps jumping up and down on an issue which then becomes lost over time. So
Right.
Again, there's a lot to be done, but I think it is heading in a better direction than, say, 30 or 40 years ago.
Yeah, absolutely. And like you mentioned, so much to be done yet. And it is true. Some of those things do seem to get lost very quickly if it's just a storm in a teacup and it's not really properly fleshed out or researched and those type of things. Nobody pays attention in the end. So really important that it has longevity when we're looking at those things. Tell me, Jayashri, you mentioned a few things that you do, but are you currently working on something? Is there something that you're very passionate about that you do on a regular basis right now?
Yes, I mean, it's always difficult for me to focus and not sort of want to get excited on so many different levels. But in the area of women's mental health, which is my main research, I have been very, very interested in working on, and we have several projects in the area of trauma experienced in early life. And this is, again, we're looking at girls.
Right.
Retrospectively, and then trying to understand the neurobiological underpinnings of trauma that happen in early life, including emotional, physical, sexual abuse trauma, and what happens down the track when this girl grows up to be an adult woman, because the number of mental ill health conditions that flow from that sometimes terrible early start in life, are there for a long time. I also passionately fight against the diagnosis or label of borderline personality disorder, because in my clinic and my practice here, a number of the women who've received that diagnosis are very badly done by, I would say, that calling somebody a personality disorder is stigmatizing and in fact misses the point, because a number of these women have had horrific traumas in their early life. And I think, if we consider the level of trauma that these patients have experienced, we would be in a better position to offer better treatments, including all of the treatments that people can access if they have a PTSD or a post-traumatic stress disorder. So that's one of my passions. I'm obviously still very much in the collecting of data for safety of drugs used in pregnancy, the psychotropic medications, and I'm going to be talking on that today. But there's a lot of work that needs to be done there. Again, if we can get it right with the bonding, the attachment, the early mothering, and early parenting, of course, then maybe we could prevent some of the debacles that happen later in life with the incidence of mental ill health. So I think my colleagues and co-workers in the perinatal area are, again, unsung heroes, and the resourcing is not what it should be, in my opinion, for perinatal services in the world. And this is another area where we need to campaign as a force to improve that resourcing, because it's so critical. That first 200 days of life.
Yeah, amazing. Well, I mean, I feel like I'm bowing down to you now in terms of like all the things that you are doing, and it sounds like you're, continuing on this journey just to keep building and recognition. So fascinating listening to the new protocols, personality disorder, something I haven't come across or heard of before. So thank you for always taking a stand and being the voice behind people who get labeled like that and when it's not appropriate. Just so interesting. Wow. My eyes are wide open. I now I'm going to be Googling it later just to see what's out there. Thank you so much for sharing a little bit about yourself and what you're working on. It's just wonderful. So,
my pleasure.
Very lastly, we just got a couple of minutes left here, but could you just tell us just briefly, this will be a sort of inside scoop on what you're hoping to share with our audience and what they'll get out of your presentation.
So my presentation is about managing mental illness in pregnancy, and there are several things that I hope the audience will take away, which includes an understanding of just how complex this particular area is, but also how vital it is to try and maximize both the mental health of the mother-to-be, but also the developmental trajectory of the developing fetus. And again, this is the absolute critical start to life, so we don't want to disadvantage a baby by having neurodevelopmental disorders, but nor do we want to disadvantage the baby by having poor attachment and bonding to a very depressed or unwell mother. So we need to understand more about this illness, and unfortunately there is little that has been done in the area that can guide us. So I would hope the audience will join me in thinking more about these issues and perhaps doing their own research in their own areas to add to the body of work that's slowly but surely developing.
Fantastic. Well, thank you for that. I really appreciate that. And yes, for our listening audience, you have an opportunity here to build on this topic. Come and join us and be part of this movement here at Gold Perinatal, where we have our add-on package, mental health in the perinatal period, as part of our Gold Perinatal Online Conference 2018. You can register for that conference right now at goldperinatal.com. You can join us and be part of that movement. Of course, we start on October 1st. You can be part of our free keynote presentation as well. And then you can also build on your activity here at Gold by adding on any one of our add-on packages as well. Thank you so much to Professor Jayashri Kulkarni for being with us here today. Just wonderful chatting with you.
Thank you. My pleasure.
And to our listening audience, thank you again for joining us, and we look forward to having you back. Bye-bye for now, everyone.